It's 2 minutes after 2, so why don't we start with introductions? My name is Brian Feely, and I head up marketing for Corporate Synergies and Foundation Risk Partners, and we're always excited to be able to host webinars such as this. Joining me today from account management, working with all of our employers, Brian Reuter joins us today. He's going to be offering his perspective from an account management standpoint, working with our employers, designing the programs, all the plan designs, and you name it. A lot of work that gets done there. Gary Cassidy joins us. He's the director of our education, communication, as well as wellness. So he has clearly a perspective on, what employers are looking for their participants to be educated on, all those campaigns. Where's the focus at? And a lot of that is driven by the feedback that we get when we listen to participants. And that's why we have Eileen Scoggins here, because Eileen heads up our advocacy unit, Benefits VIP, and she has that unique capability of learning directly from the participants where their pain points are, where their challenges are, and navigating that as an advocate for them in healthcare. So that's the team. I will try my best to keep it on task and keep the conversation going in a meaningful way. And as I said, use that chat, offer your comments and some of your questions, and we'll keep it going. I'm going to start with this. We talked about this webinar being about optimization of your benefits. What does that mean? It's a fancy word, right? Optimizing. Well, everyone may have a different opinion on that. So, Brian, when I say optimizing your benefits, what is it that from your perspective that we're talking about?
Yeah, I mean, it definitely depends on the person defining it. But collectively, I would say it may making the best use of the employer's time and the employer's dollars, the employee's time and the employee's dollars. That's why we're talking about communication, because if an employee doesn't know about a benefit, it's not, you're not using time and money well, right? I'm going to talk a lot about planning today, which is so important, one of my favorite topics. Again, if you don't have a good strategy about what benefits should we offer, you're not going to maximize their impact. So,
Yeah, so it's not just about give me every benefit you could possibly have, and I don't want to pay for it, right? There's
correct.
strategy involved, and obviously you want to be able to make sure that a benefit program is of value to your team members as much as it's about making sure from a financial perspective that you're doing everything you can to curb the rising costs that
Mhm.
everybody is dealing with right now.
Correct.
Eileen, what about from your point of view?
Yeah, from the advocacy perspective, to your point, Brian, we're kind of the listening post here, right? So we're hearing right from the participants, and to them, it really means building a system that makes them feel supported, heard, keeping them actively engaged in their benefit programs. I think optimizing the benefit solution, the ultimate goal really should be to create a culture where they not only understand their benefits, but they really have a seamless access to them. It's ensuring that the offerings are in line with their needs, their overall well-being of themselves and their family. And that may not be the same, by the way, for an entire population. So it's really looking at the different segments within an organization to see where the benefits from an advocacy side affect the different populations, so that they feel heard, that they understand their benefits, and that they have a place to go to gain that support.
Feeds right into Gary. I'm thinking about as you're saying all that great stuff, Eileen, you think about the ability for those participants to understand. So how are you optimizing on the part of education so that they do understand all of those points that Eileen made? What are you seeing out there?
The biggest, there are two or three biggest keys. The first one and the most important one is controlling the message. You need to control the message that's going out to your participants, because we don't want them going to Jack or Jill in the queue next to them and saying, hey, what do you think about this? What have you heard? People are on Facebook. People are looking at Reels. People are going to Instagram. They're going to MSNBC. They're going to CBS, NBC, Fox News, all of these news outlets that are sometimes more op-eds than actual critical news. As the employer, you need to control the message. And that messaging needs to be built around a long-term strategy. You can't just dump a lot of information at open enrollment and say, I'm done for the year. I can't tell you how many HR people get frustrated after an open enrollment and somebody says, hey, did you try this new free thing that we talked about during open enrollment? And they're like, I don't know what that is. I haven't heard of it. And it's really about controlling the message 365 throughout the year and making sure that the point of view is clear. And the third and most important thing is understanding the level of healthcare literacy in your population, because you have basic benefits and you have advanced benefits. And sometimes you have to go to basic blocking and tackling. What is coinsurance, copay, out-of-pocket maximum deductible? You have to start there. If you don't understand where your population is starting from, all the other high-level information is going to trickle away, and they're not going to be able to actively engage with that information.
And that's even more important today because I think that we were talking about this, and Brian, weigh in on it. The shift has continued to move to the employee being more responsible, right?
Yes.
So that cost shift to the employee, whereas before we always heard the stories, hey, I don't care what it is, good benefits, just don't raise my copay. That's not
Yeah,
the question anymore, right?
absolutely. And even before I say that, it's funny, Gary just reminded me, we forget how we do this every day. Even employers do this every day. We know the language, we know the lingo, we know all the many acronyms. I don't think we can be reminded enough that sometimes we might have to take a step back and explain what a copay is or what coinsurance is. Go back to the basics. Um, it really is a good reminder. But yeah, I mean, we all know that the cost and the responsibility of navigating their benefits is more and more and more onto the employee. Um, and not just bad. I mean, sometimes it is because they have a higher deductible, but it could be because what constitutes a benefit is now much broader, right? So there might be more things to take advantage of, but the employee has to engage more than they ever have before, to optimize the benefits.
So how do we do that best? Let's start talking about, getting down to it. We know that's a situation. Let's kind of like that's the landscape. Employee participants need to know more. It's more complex. It's more costly. So give us some scenarios. And Eileen, you're dealing with these folks. Are you seeing an increased frustration level, or do you see when there is a good examples of, wow, that was a great way in which we've educated them on something. Maybe, talk about the frustration that you're seeing with these shifts, but also maybe an example of where a strategy has resulted in avoiding that or
Right.
helping them to navigate.
I think, first and foremost, it's essential that employees, along with their spouses and their adult dependents, I mean, they're utilizing the plan as well, know where to go for their questions or their issues. Where can they go with these frustrations? Where is a centralized location? Here at Corporate Synergies, that's obviously we promote Benefits VIP heavily as that support advocacy team. But it's crucial that they feel empowered and that they know that they have advocates, whether that be through their HR partners or through an advocacy team like mine, that they can go to with their issues and their questions, and that person is going, or that team is going to take a counseling approach, right? Really answering those questions that the employee didn't even know to ask. So it's more about not just resolving their issue, but their guidance on different benefits. And to your point, Brian, we are seeing a shift. We're seeing a shift in frustration. I've been doing this for over 20 years in the advocacy space. And for the last 19 of those years, it's been the big bad insurance company is the problem. Or if I'm being honest, some participants will blame the employer for the plans that are in place. But the shift that we're now seeing is actually towards the healthcare system in general. That can be their hospital, their radiology facility, their lab, their primary care or specialist. And it's starting to garner a bit of a negative reputation with issues ranging from, delays due to staffing, untimely prescription refills. They can't get pre-authorization requests in on time. But additionally, the high cost of healthcare is what's becoming apparent to people. And I think that's because the market has shifted so much towards a consumer-driven health model with deductibles in place, whether it's a smaller deductible or a higher deductible. People are starting to notice what hospitals are charging for a 2-hour ER visit, $15,000 for a CAT scan and a Tylenol. And they're becoming increasingly frustrated in the amounts going to deductibles. And they're no longer blaming the insurance company. It's now the hospital. And, another example, Brian, that we actually just had come in within the last week or so is somebody couldn't make it to the specialist office visit. So they set up a telehealth appointment with their specialist. This is not, one of those teledocs or MD Lives. This is their actual specialist who submitted the claim, and they charged $1,400 for a telehealth office visit. And the first call that person made was to the benefits VIP team here for us to look into, to say, is this right? I mean, I know the full 1,400 isn't going to my deductible. Turns out it was about 675, but still, even 675 seems completely outrageous for a telehealth office visit. And so I think that from a plan perspective, from an insurance carrier perspective, it's being allowed. These providers are being allowed to charge these amounts. And I think the frustration is shifting not just to insurance carriers, but also their own individual healthcare providers.
Wow. Brian, I see your head nodding.
Yeah.
Any commentary
Well, I
on
mean,
that?
it's there's so many things there, but first, it's another example of how benefits are more complex or even confusing. Post-COVID, brick and mortar providers started offering virtual visits, right? Now you might have a benefits plan, where your employer offers Teladoc, right? An actual company that's delivering telehealth services, but then your provider might also offer telehealth, right? Brick and mortar provider offering telehealth. Now, those two visits are often going to have a completely different copay structure and cost arrangement, right? So try to figure that one out. We ran into that so many times of trying to help employees understand the difference between, a Teladoc company or vendor and a telehealth service.
Is there any rules or guidance around the telehealth side of it? So, like, for instance, if you have a program and from a teledoc standpoint, this is what you will be charged. I mean, is it kind of just opened up on the telehealth and it's up to that particular physician or specialist, or where's the control on that? And how would, for instance, let's say I'm in that boat, can't make that appointment, or I need to talk to somebody right now. It's telehealth, and I talk to my specialist. Do I ask, well, how much is it going to cost me? Should I know? Like, give me some scenarios around that. I'm sure some of the folks on the line would like to know a little bit more about that.
Yeah, I mean, you can try to design the plan, so that on the provider side it's similar, but it's not easy, right? And if there's a deductible, if that service is subject to a deductible, it's near impossible because they're all going to charge, a different cost. Gary mentioned like some benefits are simple, some are complex. Like this is where we start getting into very, very, very complex, I would call it. But doable with the right communication strategy. Reference-based pricing is a place where some employers are going. So we're not just talking deductible and co-insurance anymore. We're talking, really getting to the weeds of what providers are charging or should be charging. Even things like provider administered specialty drugs, right? So if you have a need to get a infusion, right, at a provider's site, right, that drug, the specialty drug has a price tag, right? So is the provider purchasing that on your behalf? And if so, are they doing it in your best interest? Sometimes, absolutely. Sometimes there might be a markup involved. Sometimes the provider doesn't even realize that there's a markup involved, right? So now, we're forced to look at some outside vendors to source that drug to then be delivered to the provider so that can then be administered to the patient, right? So that's a good example of benefits getting increasingly complex. And I would say it kind of goes along with what Eileen was saying as more of a focus toward the healthcare systems, not just the insurance companies.
And Brian, to your point too, you said, is it okay? Should an employee be asking? I think it's been taboo for so long that patients didn't want to actually ask a provider's office, how much is this going to cost me? You have to do that in this day and age. If you're not being a good consumer of the plan. And that's especially if you have something outside of a copay plan. It is absolutely acceptable for a patient. And this is something we, often communicate when somebody contacts us with a coverage question, or even after the fact when they've already incurred the claim, that it is absolutely okay for you to say, I'm switching this over to a telehealth appointment. What's your average cost for this? What is it that you're going to be submitting towards my deductible? Or, I'm coming into the office visit for this special infusion. Let's run a predetermination of benefits with my insurance to see what my out of pocket is going to be. And I think people are so hesitant to do that, just based upon, how things used to be in the healthcare industry with flat copays. I think people need to be a little bit more vocal on their own behalf and advocate on their own behalf and ask those questions when they're making those appointments.
Well, I think I've seen this before. And Gary, how many times have we seen when we set up the communications and education? That reminds me of the ask your doctor,
Yeah.
right? Know your, yeah. So why
Well,
don't you talk a little bit about that?
yeah, I mean, we have communication campaigns called Put Your Doctor to the Test, reminding people that they are the patient and that the doctor is there to serve them. For too long, it's been a case of, well, the doctor says it, so it must be right. That's not the case. That's where, when we have our wellness programs and we encourage people to go to their annual physical, we have a list of things that they want to talk to the doctor about. Brand, generic, conflicting things, getting costs for MRIs and this and that, and how is that charged? Getting them to be take active control of their own healthcare benefits and services. Because as I listen to Brian and Eileen talk, I keep hearing one word over and over, and that's more. There's more available. There's more things that they need to know. There's more things that they need to do. And the fact of the matter is, it's sometimes more is more, but it gets lost in the shuffle. I'm going to give you an example. I bought a new car 2 years ago. I got in the car, I got the sport model. It had all the upgrades on it. And as soon as I got in the car, the only thing I cared about is, how do I put it on drive? How do I set my radio? Where's the directional? Where's the wiper? And 2, 3 years later, now I'm starting to learn all the other things that the car can do. And that's the consumer mindset when they go to open enrollment. What's my copay? What's my out-of-pocket maximum? What's my deductible? If there's an HSA and they're educated about that, is there a max I can put in? How much is the employer going to put in? But then you have all these other great services. We've seen benefit guides go from 20 pages to 40 pages because of all of the more that the employers are making available to their employees. And when we have a conversation with our clients about post-enrollment communications, which are as important as pre-enrollment communications, and they say, what should we talk about? I said, your benefit guide is your outline. You want to dice and slice that benefit guide, and you want to promote one service, one perk, one this, one that throughout the year so that it stays first and foremost in their mind. Otherwise, all that more is not going to be utilized, and you're not going to see the value of the investment that you're making in it.
Yeah. I, you know, there is so much, like you were just saying, there's more. And I know that during COVID and leading up to it, there was definitely, it seemed, a shift to surrounding the core benefit programs with other services. We went into a time frame there during the COVID period where people were at home, they weren't at the office. The mental health became that much more important. And then I just look at my phone, at lunchtime, and I just am reminded of where we are right today with the nervousness, the stress that people are under from, our the potential that all of the financial implications that are happening right now. There's lines around the corner at Costco, mental health once again. So all of these services, all this more that we're talking about seems to be extremely important. And when I think about going back to the basis of this webinar, optimizing your benefits means a lot of different things. And maybe right now, optimizing your benefits is making sure that those components of your program that have true impact to your participants right now during what's happening around all of us is so important. So it's almost like you have to be able to be at the command center and say, okay, I'm gonna fade this one up because right now that service is extremely important to my program, to my participants, because if I'm truly optimizing it, I'm increasing the value of any at any given point of what I have available to me. And right now, it just seems to me that some of those services are really important in today's day and age over the last couple of months. I don't know if you're seeing that, but I think that's an important lesson that we have to take back and relook at, well, what is our program and what is it about the program that I have right now that I should be focusing on? To your point, Gary, what should I be educating on? Because I do the same thing. I get into the car when I'm renting a car and I'm driving out. I'm like, wait, hold on a second. I don't know. Where's the windows? Where's this? You don't focus on it at that point. But when it's time to use it, all of a sudden you're like in a panic mode because you didn't really listen. So we have to also take some control there and say, hey, all the folks out there right now at this time, they're going to be moving those mirrors. Let's talk about how they can do that. So any commentary on that?
I mean, I
No,
would
I think,
say
oh,
at a
go ahead,
time
Brian.
like
Sorry.
this, it shows, to Gary's point, you can't just communicate at open enrollment, right? Because if your
Right.
open enrollment was in October for a January benefit, now middle of March, things are very different, right? So you might need to pivot to a communication to remind folks about their mental health resources or their, the financial program that you put in place, through one of the carriers. So things are very they're rapidly moving, right? So you might need to adjust your communication strategy, a few times a year to be
Well,
effective.
Brian, talk about this. I know it involves everybody on the call too. Talk about the life cycle. I know we talk about the client life cycle, and if you're going to truly get the most mileage out of your program, you have to stay in constant connection with your account management team on what's happening, what's the trends are. Maybe that's a reminder. Hey, maybe it's time we do this. I know, Gary, you talk about your timeline, your action plan has to align with the employer's timeline for what they have going on within their industry, within their company, and account management from all the things that they have on their plate so that you're hitting these things at the right time and looking at what's surrounding you with current trends and the makeup of things happening, current events, so that you can say, hey, we need to pivot or whatever. But how does that work? And Brian, if you could speak to that from annual life cycle and
Sure.
and how that works to optimizing the programs.
Yeah. I mean, on a very broad level, there's really five main components of the life cycle. There's the planning meeting, and then there's the strategy meeting, and there'll obviously be some overlap on those two, but those are usually, spaced out a little bit. Then there's the renewal itself, right? And then you prepare for open enrollment based on what's decided, and then an open enrollment debrief. And the most important one for this conversation, I would really say, is that planning meeting, because that's, open enrollment is over. Everyone's taking a breath, right? That's the time where everyone kind of steps back and, really just starts to whiteboard everything. Everything's on the table, so to speak. We always say invite, as many, stakeholders in the company from as many different departments as you can get should be there. So finance, marketing, benefits, obviously, whoever might have some ideas or even input into the decisions that are going to be made for that following year.
Are you seeing more surveys happening with clients trying to make sure that they're getting feedback
We are.
from their
Yep.
participants?
Yep. And that's a great point. I mean, that you have a survey, you have all these things that employees have said. What do you do with that information, right? It's really the planning meeting. And sometimes you might have to prioritize, if everything's important, nothing's important, right? So what things, these are all great ideas, but which ones do we have? Which ones does the employer have the resources to do, or maybe the finances to do? Which ones are ones that we really want to hone in on, and you want to have a good idea of that early. Not right before the renewal, right? You want to have it before things really start ramping up. You can obviously shift, but you want to have a general sense of where you're going, and the information that feeds that meeting is going to come from a lot of sources, and it should be happening like it should be top of mind throughout the whole year, right? So it could be the middle of the summer and you're realizing something about your benefits, and you should be, well, let's put that on the list. You know, when someone says, let's put that on the list, like I know what that means. That means let's put it on the list for next year. You know, keep your list, I'll keep my list. And then when we get to that planning meeting, here's all the things that came up throughout the year. You know, it could have been a pharmacy commercial on TV that a lot of employees started asking about. Those should be captured, whether it's a survey or informally and everywhere in between. You know, and then the planning meeting is where those kind of get hashed out.
Just a reminder, we have that chat open, so I didn't notice any comments or questions. So don't be shy. You know, ask your doctor. Well, ask the panel. You know, why not?
Yeah.
Eileen, did you have something to add?
I did to the mental health aspect of it. You know, if anything remotely positive came out of COVID, I think it was the majority of the population kind of removed a stigma around mental health. And I think for so long, mental health really was as a part of a benefit package, almost seen as a perk, right? You have an EAP that offers 3 or 6 visits telephonically. That's just built into your life insurance plan, you know, just kind of a perk. But now we're starting to see a real shift from employees and participants reaching out to us, sadly, not just for themselves, but for their adolescent children as well, their dependents. So, you know, I think culturally from a benefits team, an employer standpoint, it's really ensuring that mental health support is a key part of your benefit offering and no longer just seen as that perk, you know, including counseling, stress management, financial wellness, wellness initiatives, and really fostering a culture where mental health is taken seriously and where employees feel comfortable seeking help. Whether that be to the benefits team or whether, again, that be to a centralized advocacy team like Benefits VIP. I think communicating where to go, you know, Brian, you were talking about now you have that problem and now you're looking for, you know, how do I roll down the window, right, of the car? And it's now that they have a mental health issue, they're scrambling. Where do I go? And it's communicating that for any benefit scenario, any benefit question or issue, here's where you go for all of these items. And that kind of takes that stress away from just seeking the guidance and the help. But I really think providing those resources, and Gary, maybe you could talk a little bit about communicating that about work-life balance and access to the different programs. And, you know, you get these 40-page benefit guides that will go through with people page by page, but it's really fostering that program within the HR and benefits team and really globally throughout the employer that I think makes a difference.
I mean, I can definitely tell you in 2019, I had 30 client wellness programs ready to go and pull the trigger on. And then the next thing we know, we're all work from home. And I had to rewrite all 30 of those that were focused around different things than just what I affectionately call blood, broccoli, and exercise, the biometrics, the health assessment, and walking around the block once or twice. The things that really came to the fore were the different dimensions of well-being, whether it's physical, whether it's emotional, whether it's social, psychological. I mean, think about it. There are people in your office who thrive in the group environment. There are people in your office who thrive being more isolated, but still we came up with specific challenge campaigns for isolating at home and for protecting yourself. And that's carried on straight through because before, as Eileen said, nobody wanted to talk about it. But the fact is, it's out in the open and it's there. The pandemic is over. We're on hybrid work schedules. We're on back to office. We're some kind of a combination. But those still, with everything going on right now, that emotional toll, the psychological toll, the social toll, financial, spatial, all of these different dimensions are having an impact on the employees every single day. And not to plug myself, but I'm going to plug myself. I am having a webinar in April, which is going to specifically talk about the difference between stressed and disengaged employees. And all these dimensions of wellness play into that. And it's important to recognize them not just as shrug it off, it's something that is impacting employees' productivity and their ability to do their jobs on a daily basis.
I've seen that presentation, by the way, and that was really good. I remember that from last year, and there is a difference for sure. And by the way, I'm very sorry that you were reminded of what you went through. I had forgotten that about the changes to those wellness programs. But that wasn't just you. I think that was everybody related to employee benefits for sure. Um, I want to make sure that, when we talk about optimization, a lot of times we do go back to cost
Yeah,
reduction. And
you have to. You
yeah,
have to
right.
these days. You can't say that word without at least addressing the
You have to.
dollars.
It's unsustainable.
Hmm.
So, Brian, what are you seeing there? What are some of the approaches that maybe have shifted over the course of the last couple of years?
Yeah, and I mean it would be unfair to have this discussion without, the cost savings. That's just necessary. I mean, it's just without some action being taken place, there is no benefits plan, right? Or the it's just vital. I'll say that. So, a lot of what we're talking about does go hand in hand. Sometimes an employer might need to put in a benefit, which is complex, which does require and more employee engagement because it has the potential to save a lot of claims dollars, and that filters down to employee cost share and employee contributions. So, yeah, I mean, everything that we're talking about, like the programs, provider specialty medication, carve outs, or reference-based pricing, or, the higher deductibles. But with those sometimes necessary changes, you do need to kind of beef up on the communication and the
Yeah,
education.
And
it's
for the
more
reference-based
surgical.
pricing, oh, I'm sorry, Brian. For the reference-based pricing, we've saw quite a few clients move to that
Mhm.
1-1 actually, and it really did increase volume on those clients here
Yeah.
within Benefits VIP. Um, are you seeing a lot, Brian, are you seeing a lot of groups starting to consider that model versus the deductible copay
Yeah.
arrangement? I mean, in those
Yeah.
models, communication is obviously critical, but are you seeing that on your end?
Yeah, I mean, when it first came out, it was really almost viewed as like the last step, right? Full
Yeah.
full replacement, or we're going to do away with benefits. Now we're actually seeing more of a dual approach of where you might offer a traditional plan side by side with a reference-based pricing plan. So that's going to require more education. And it's a lot of it is about transparency and what these hospitals are charging.
For the reference, can you just a 1 minute overview on reference-based pricing in case people aren't aware of what that is? I think most are, but just in case.
Sure. It means that for certain services, really facility for the most part, there is no network. There's no pre-negotiated cost of a service. You have that cost of care. The employee has that cost of care, and then the claim is negotiated post-claim based on a percentage of what Medicare is going to pay, because that's typically going to be a lot lower than even some of the best discounts out there.
Yeah.
Yeah.
And to your point, Eileen, you're seeing a little bit more, but and I think Brian, you said it was viewed as a last resort because I know there had been many uh, employers in the nation that grabbed onto that as, hey, look what we can do. We can drastically reduce. But if you did not include a really well-defined educational program,
Yeah.
you're leaving your participants out there to fend for themselves, not understanding the complexities of it. But
And it's the same theory of, you don't just introduce a high deductible health plan with an HSA at open enrollment and here it is. That's something you want to start campaigning 6 months, 12 months out so that people understand. Same thing with reference-based pricing. It's not something you can just drop in your participants' laps and hope that they understand. And so we do see a lot of meetings, webinars, communications surrounding the reference-based pricing before groups go live. And then, of course, they have the Benefits VIP team here for when they get a bill and they say, I have no idea what to do with this, right? And then we're explaining how it's negotiated. Don't pay that bill. So we're kind of providing that education on the back end. But we are hearing a lot more about those types of programs,
Yeah.
which is interesting.
And
I'm
it's
not so sure
important.
it's a last resort anymore.
No, it's not. And it's important to highlight that you're saving the employee money as well,
Right.
especially if there's a deductible in place, right? You're advocating for their dollars just as much as the employer's claims dollars.
any other trends that you're seeing Given the healthcare rise in costs and sticking with the cost component for a second.
Yeah, we talked about transparency and like, ask for the cost up front, like I'm sure everyone on the line is probably saying easier said than done, right? Because the transparency tools that the carriers have are not always helpful. Sometimes they're confusing, sometimes they're not accurate. So they have a long way to go, but they are starting to we are starting to see some real progress in some of these carrier tools. I can think of one vendor in particular that has a really slick model, right? That's using technology to have a better idea of the cost of a service beforehand, right? Kind of that shopping around.
Mhm.
It's still a challenge, but we are seeing it getting better. And I think that's so important because there was such a huge push, especially around high deductible plans, shop around, shop around, shop around, and folks would do it or try to do it, and it just wasn't really as effective as I think people had hoped. So, but it's getting there.
Sticking with the technology front, Eileen, I want to take an opportunity to ask, how is that working for you? You have the mobile application for Benefits VIP, so advocacy available to you through mobile. Are you seeing that play a role in this?
Huge role. I mean, aside just from navigating the benefits through an app, the most requested item through the Benefits VIP mobile app is for care plans. And as a part of those care plans, there's a team of health guides through the mobile app that will actually reach out, find out what the, allowed estimate is and what your out-of-pocket cost would be for your specific plan. So we have seen a big spike in people utilizing the mobile app for that very reason. To your point, Brian, I think for so long, we did the industry was pushing these consumer-driven health plans with no tools for the actual members to be educated consumers. And while we've come a long way, there's still a long way to go. So having resources like Benefits VIP Mobile or having an area within the insurance carrier where people can call. Again, it's knowing who your advocate is for your organization, for your employees. Where do I go with these questions? If it's a surgery, if it's a procedure, and we have all of the information, we will bully the insurance carriers until they give us the allowed estimate, right? So there's a number of different ways to find that information for us, but it's key for people to know where's my centralized advocate within the HR and benefits team or with my broker, so that I can find this information.
And what's great about your team, I mean, I'm sitting right next to you and you're awfully loud. I can
Yes.
hear you through the wall. But anyway, aside from that,
Sorry.
sure I am. No, I'm joking. But you have the opportunity for all of your advocates to share information and trends. I know you
Yes.
have individual reports that go out to clients and employers, but you have the ability to kind of take a debrief on what's happening from everybody and make sure that, okay, we got to make sure that we're going to be able to help them navigate this. We see this rising or whatever it might be, because I know because I'm sitting right outside the door
Yeah,
here.
it's great. It's great that we're all together and we're looking for those trends and we have regular collaboration meetings. And so we're discussing the same things that, HR and benefits teams are up against and what they're discussing and collaborating on. And that's what trends are we seeing overall and what trends are we seeing for specific employers that we can bring to Gary and his team's attention for communications. So yeah, so it's vital that we all cross collaborate here internally. But I think so from an HR and benefits team as well. If you have a large HR and benefits team, it's important for you to do the same.
So what I've heard, I know we're coming down. I said we'll be here for about 40 minutes of this discussion, and so we're hitting that. But I just want to say what I'm hearing is that um, you need to know your audience, number one. Somehow you need to make sure that you're getting that feedback, that touch point, that listening post that you always talk about, Eileen. You need to make sure as an employer that you are the listening post for what your teams place value on. If you're going to be looking about how do I optimize my program, well, you have to first understand, well, where's the value from their team members' perspective? Where's the need? What is it that needs to be addressed? So that's part of it. I'm hearing that client life cycle, that touch point throughout the year to be able to pivot should things happen. Stock market's crashing, people are getting laid off. Oh my goodness. Hey, let's maybe push that lever up a little bit on this part of our program, I think it's necessary right now. So sticking with that whole life cycle. Gary, you talk about education. You don't just dump a lot of information at one point in the year. You have to be strategic in terms of how you ensure that I don't just drive right out of the rental car station and never realize at a certain point in my drive how to do something. I've done that. I've actually stopped a car in the middle of the highway thinking that it acted the same way my pilot did. That was not good. So anyway, true. So education in bite-sized pieces to make sure that they understand it is important. And you're only going to know that, Eileen, right? You're going to know that because you're talking to them. And if they have challenges, repeatable challenges, maybe there's something we need to do for that particular segment. So closing thoughts. I'll go around the horn. Brian?
No, I just think this was a great conversation, and it reminds me at least how many components and it takes to run a successful benefits year. There's the planning, and the implementation, which is kind of where we come in. But then the communication, the execution after those decisions have been made, where Gary and his team comes in, and then just the help all year long from Eileen and her team. It's just takes a village, it really does.
Gary?
I'm just going to piggyback on something Eileen said, and I just want to reinforce it because it's huge, is open enrollment is not the time to learn, it's the time to make a decision. It's too late to learn. The 2 or 3 months after open enrollment are the times to remind people of all the benefits and services that they offer. And the other 6 months of the year is where you educate them about what's coming up and what they need to know to be prepared for the next open enrollment season.
See, that was in bite-sized chunks. I understood everything that you happened to say right there, Gary. That was good. That was
That's
good
the first. I promise I won't do that again.
Eileen?
It's really all about your employees feeling supported and their spouses and dependents as well, and knowing where to go, making sure that they have that advocate on their side, so that they're educated, they feel empowered, and more importantly, that they feel heard, that they're not feeling like they are stuck with this issue, or they're not hearing, they're not being heard about their perspective on the employee benefit program being offered. So it's really about opening up the doors, and when you say my door is always open, mean it, and take that feedback back from the consumer, because it's all about productivity, it's all about them getting back to work and them feeling satisfied with the benefits that their employer is offering.
Excellent. I want to remind everybody that this and many other resources are available on our Knowledge Center at corpsyn.com. It is where you will find on-demand webinars, articles, other resources, as well as keeping informed of upcoming events that we're going to be holding like this, and like some of the more accredited, a little bit longer webinars for HRCI and SHRM credits. We have forums that are going to be coming up in our location, so keep an eye out for that. They're always a blast, a lot of fun, a lot of education, and we look forward to it. In the chat, we just dropped in the link to that page for you to find out more. I also want to throw out there that, we talk about the participants and educating them and keeping them informed, whether it be educating on benefits or whether it also be about how to utilize healthcare, mental health issues and things. Healthdiscovery.org. You don't have to sign, just go there, healthdiscovery.org. It's built for the participant. You might find that valuable. Send it out to your participants. That is also just dropped into the chat window as well. So thank you, everybody, for joining us. We look forward to seeing you the next time on one of these great informational topics that we hold here at Corporate Synergies. Enjoy the rest of your day.